So I am Kanwalraj Moar, and I'm a cleft surgeon. And my background in cleft is that I did maxillofacial surgery first. So I'm a maxillofacial cleft surgeon, and I carry out all the surgery from babies right through into adulthood. So that can be primary surgery, so your cleft lip, your cleft palate repair, bone grafts when they're about 8 years old, and then going on into adulthood, rhinoplasty, osteotomy, and then any other revision surgery that's needed in between. So it's the 3 primary surgeries and then anything else.
Question 2. What is the best part about a career in cleft care?
Lots of really good things about a career in cleft care. And I think about what drew me to it in the first place when I was a trainee. So I was very lucky that I trained in the Northwest, which means that there is a cleft service based out of Alderhay Hospital. And as part of that, I got to see lots of the cleft clinics and then a lot of the operating. And what makes cleft quite different from other surgical specialties is that most of the work that we do is based in a multidisciplinary team. So you are working with other specialties such as speech and language therapy, cleft nurse specialists, psychology, paediatric dentistry, orthodontics, and they all come together to look after the patient. So you're working in quite a different environment. You're not an isolated clinician. The second thing around it is the patients themselves. They're yours to look after through their entire childhood, right through into adulthood. So you see this baby, you see the parent, and you see them from 2-3 months old, and you're taking their care. You're going to be looking after them potentially for the rest of your career, 20 years, and you will see them regularly through that time. And the surgery is just part of that, is just a snapshot of what you do. So you're doing this operating when they're a little baby, and then you see them again and again. You watch them grow up. You see the impact your surgery has had on them, and then you help them again if they need it, and you help them again. And so the input is just so much more global and longer than in some of the other surgical specialties. So if I was doing max backs and I fixed a broken jaw, I'd see that patient, I'd fix the jaw, they'd go away, and I wouldn't see them again after 2 months, and that's it. Your interaction's very short. Whereas with cleft, you've got this team, which is the family, and then that family looks after another family for an extended period of time. So it's a very different style of working to other surgical specialties.
That's a great answer. Cool. Question 3. What is the most challenging part of a career in cleft care?
So 2 aspects again to that. There's a career in cleft care, and then there's working in cleft care, and the challenges are slightly different for both of them. So to be a surgeon in cleft care, you've got to have done your baseline training in one of the appropriate specialties. So that, you're looking at max fac, which is already a 2-degree specialty, plastic surgery, which again is very competitive to get into, ENT, another competitive specialty. And you have to have finished your baseline training in that, and then go off and do more. So you're looking at probably at least a year, but I'd say a good 2 more years of training on top. So that, and you've also have got to have been in the right places to do that. So if you're not lucky like me, where I was in the right training location as a junior, that I got exposed to it, if you have an interest, you have to move to go and do that. And I did move through my training. So I think that's the challenging part of becoming a cleft surgeon. I think the challenging part about working in cleft is it's very specific, intricate surgery on patients that can be very challenging in themselves medically. And rightly so, they have high expectations of their outcomes. Often these patients are well, so that they want a nice outcome, and that's what we're trying to achieve. And your result is going to be there for life. 70 years. So the level at which you work in cleft is always very high, it's very specific. And I think there's a lot of thinking involved around that, and trying the detail with which you operate is high. When I'm operating as well, a lot of the work I do is under a microscope or under magnification. So that, again, is you're concentrating a lot when you're operating. And then in the clinic, because you're thinking long term and the impact of cleft can be much wider than just surgical impact. So it can be on speech, education, their self, what they think of themselves. Your global care of the patient has to be much wider, otherwise they don't get what they need. So it's not just about the surgery, it's about everything that comes with it and how they fit into their lives. And you have to put quite a lot of your soul into that to make it work. Otherwise, you can't do what that patient needs. So I think it's weird because the challenge and the reward are two sides of the same coin, actually. So the things that make it challenging also make it rewarding as well, that you provide that holistic care, which means you've really got to think about it a lot, but the outcomes of that holistic care can be fantastic for that patient.
Question 4. What excites you most about the future of cleft lip and palate care?
This is a tricky one because you see leaps and bounds, but they come at distances apart. So I think the last big change we got in this country was probably about 20 years ago when they centralised all the care. And that was a very process-related change in cleft, lip and palate care. And I think globally, trying to take that out globally to other countries and other services is a good thing, and showing the results you can get from that type of care. That's process, but what you're doing within that process isn't changing that much. I think the things that are going to make a big difference are studies like the Cleft Collective, where you're looking at genomics, you're looking at phenotypes related to genomics. So are there underlying causes? Do those underlying causes change your outcomes? And then what will happen as we gather that data and bring it all together, you can look at a patient in the whole and say, right, I know this patient has got this type of cleft with this underlying gene type, which means they're going to get these outcomes. So as I do their care, I'm going to tailor it and focus on that. I know their educational outcomes may be poorer, so I need to put more effort into that, or they need more psychology support, or they need more speech and language support. So for me, that knowing what your outcome is going to be, or potentially going to be, is really valuable. The other things that may then come out of this long term will be more things around things like patient-specific implants, looking at ways patients scar, and the technical advantages you're going to get from your 3D work, your visual realizations, and that side of things as well, which will mean that when you're talking to patients, they're going to really, and the parents, they're really going to know what's going to happen. So it's using technology to advance that care. So at the moment we use a microscope, and there will come a point where we'll probably progress to robots for things like the pharyngoplasties, which will change care as well. So it's sort of a tailored care approach, and then using the technologies in a way that will benefit the patient.
And final question, what advice would you give to a student or trainee interested in the cleft lip and palate specialty?
Find a consultant that you get on with, or that seems approachable, and there's lots of us. And actually, to be honest, yeah, I think they're all approachable. There's not that many of us in the country, to be honest. And just find out how you can go and visit. So go to a unit, spend some time there, see what's done in this country. And then once you've done that, and we're a bit limited at the moment because of the pandemic, I would say do a trip abroad. Go on a, go to a unit abroad, have a look and see what they do. Go on a cleft trip with surgeons from this country, and just get involved and see the surgery, see the work that's done, in the clinics as well, actually. And if you're thinking, I like this, and this is something I'm going to pursue, then the next step is, what extra work can you do? And that's when you're looking at audits, the valuations, research, go to the conference, the craniofacial conference, and start getting involved and showing the cleft world that you're interested, and just getting a handle on what it really means. So you're building a portfolio over a long period of time. And that portfolio is not just about demonstrating to people who will give you a training post that you're interested. What it does is it actually builds your own interest and layers your knowledge. And so when you do become a consultant or even a trainee, a higher trainee in it, you're really already engaged and immersed in cleft as a specialty, so you get the most out of it.